여러분 안녕하세요.
Greetings, I'm Professor Park Chang-joo of Maxillofacial Department of Hanyang University Dental Hospital. I'm also a Master Course Basic Director. I'm going to talk about doing sinus lift using alveolar crest approach. Let's look at the sinus lift and the alveolar crest approach. In oral maxillofacial surgery, there are three major journals. First is JOMS, or Journal of Oral Maxillofacial Surgery. Second is BJOMS, British Journal of Oral Maxillofacial Surgery. And third is International Journal of Oral and Maxillofacial Surgery, or IJOMS. Journals of maxillofacial surgery, they can be a bit vague in terms of contents. However, they can be great help clinically, and there are many techniques that can be actually used readily. This is a study published by myself in 2021 in IJOMS. This study was about transcrestal sinus lifting. I worked with Professor Do Jung-hoon of Busan University, and this professor has helped me devise tools where we can measure the pressure that is applied to the sinus membrane when we do hydrolift. And we actually used these tools and gained results and published this study. We measured the hydraulic pressure that is applied when the sinus membrane is separated from the sinus floor and lifted. Hydraulic pressure was measured. Casket, which is a prominent crystal approach kit from Osstem, was used. A tool that can measure the pressure applied on sinus membrane was made. In 9 patients, measurements were made. These 9 patients had flat sinus floor and had healthy sinus membrane. This is how we performed the study. In other words, we did not perform these tests on patients with a swollen sinus membrane. We also removed the patients who either had the sloped sinus floor or septum. Different methods were used. Castril of casket was used to penetrate the sinus floor. The sinus floor was penetrated, but the sinus membrane was still intact. What will the casket do in this case? As you well know, hydraulic membrane lifter is applied. I'm sure you're all well aware that saline water is connected to hydraulic membrane lifter. In doing implant site preparation, hydraulic membrane lifter is applied, saline water is applied little by little. By doing this, you can measure the hydraulic pressure that is applied on sinus membrane. When you first fill saline in the area where implant site preparation is done, the pressure does not increase significantly as it is continuously inserted. The pressure is maintained low, but once the implant site preparation site is full of saline water and as direct pressure is applied to sinus membrane, then you can see spike in pressure because up to the point where sinus membrane is separated, the pressure continues to increase. And once the membrane is separated and once the saline is inserted, then the pressure becomes reduced. This is the general phenomenon we can see in hydraulic technique when we do crestal approach. Once the saline goes in, the pressure will go down significantly. Regarding this, what we're most curious about and what is most clinically important is the peak pressure in which the sinus membrane is separated from the sinus floor. If we can understand this pressure properly, then we will be able to separate the sinus membrane more efficiently and safely using casket in doing crestal approach. Let me look at the results. In 9 patients, approximately the peak pressure was about 25 kilopascals. I've thought long and hard as to how I'm going to explain about this. 25 kilopascal is equivalent to medium suction power of Dyson's wireless vacuum cleaner. It's the same with other vacuum cleaners as well. It shows similar values. Let me emphasize once again. The pressure in which the sinus membrane is separated using hydrolift method is about 25 kilopascal, and this is equivalent of medium suction mode in vacuum cleaners. What do you think about that? More so than thought, high hydraulic pressure is required, and this was found through this study. In doing hydrolift with crestal approach using casket, more so than anticipated, higher pressure is required to separate the sinus membrane from sinus floor. Please remember this point. I hope this was of great help in your clinical practice. This is not all. If you register offline master course, you'll be able to get your hands on much more information and do actual hands-on practice. I hope to see you in Master Course Basic course face-to-face. Thank you for watching.